Hi guys, my name is Moises Ceballos and I'm going to talk about the findings of the lower extremity dynamic screen in patients with patellofemoral pain syndrome. In definition, we have that the lower extremity dynamic screen is a previously developed instrument used to visually assess hip and knee kinematics during dynamic activities. The purpose of this study was to compare the lower extremity dynamic screen scores between a patient population with healthy control subjects. In applications in physical therapy, we have the lower extremity dynamic screen is a previously developed instrument used to visually assess hip and knee kinematics during dynamic activities.
In this video, I'm going to give a description of what patellofemoral pain syndrome is and if and how we can diagnose it. Hi and welcome back to Physio Tutors. Patellofemoral pain syndrome, or PFPS, typically refers to anterior knee pain usually occurring during activities such as running, squatting, or walking up and down stairs. Patients of all age categories are affected, and the condition can persist for multiple years in up to 60% of cases. So what is causing the pain? Loading of the patellofemoral joint during weight-bearing activities on a flexed knee is thought to be altered due to various reasons, leading to pain. One hypothesis is abnormal patellofemoral joint alignment and morphology of the trochlea. Consequently, the patella can't track smoothly up and down, which over time can cause irritation of the joint surfaces and trigger nociception. Secondly, muscle weakness of the quadriceps and glutes is a potential risk factor associated with PFPS. This is because poor strength and function in the quads will influence how the patella tracks in the trochlea and how load is distributed across the patellofemoral joint. Weak glutes, on the other hand, can alter the lag axis if the femur adopts a more internally rotated position with regards to the tibia, again impairing smooth movement of the patella within the femoral trochlea. On our channel you will find proposed diagnostic clusters for PFPS, but all of them only demonstrate weak clinical value. You can find the clusters by clicking the info icon in the top right corner. Essentially, asking a patient whether they have anterior knee pain while squatting is the best available test to date, as PFPS will be evident in 80% of people with this finding. But PFPS has to be seen as a diagnosis of exclusion, meaning the diagnosis is formed after all other possible pathologies have been excluded. Alright, I just mentioned that you'll diagnose PFPS only after excluding other pathologies, so be sure to check out our knee assessment playlist on the left. A collection of all tests, including evidence and description, can be found in our assessment ebook. Check the first link in the video description or click the icon in the bottom left corner of the screen for more info. Before you leave, make sure you are subscribed to our channel and check out our other social media pages. This was Andreas for Physio Tutors. Thank you for watching and I'll see you next time. Bye.
In pros and cons, we have that the pros, strength, flexibility, kinematics, and in cons, probability of injury.
In this video I am going to talk about the Y balance test in order to assess a patient's postural control, range of motion, strength and proprioceptive abilities.
Enroll in our online course now. Link is in the video description.
Hi and welcome back to Physio Tutors. The Y balance test is a shortened version of the STAR excursion balance test. It is reduced to test the anterior, posteromedial and posterolateral reach. According to a study of Pliski et al. In the year 2006, the Y balance test has an excellent inter-rater reliability between 0.48 to 0.78. To conduct the test, place 3 stripes of tape on the ground in a Y shape. The angles between the anterior stripe and both posterior stripes are 135 degrees with 90 degrees between the 2 posterior stripes. Before the actual test is started, the patient is allowed to make 4 to 6 practice trials in each direction, after which your patient can rest for 5 minutes. For the actual test, the patient has 3 official test moments. For the anterior reach, the stance foot is placed with the toes at the 0 mark position of the anterior reach direction line. For the posteromedial and posterolateral reaches, the heel is placed at the 0 mark position of the anterior reach direction line. To start, have your patient stand barefoot on one limb with his hands on the hips and ask him to try to reach as far as possible along the tape stripe. He or she needs to perform 3 trials, standing on the right foot reaching in the anterior direction, followed by the 3 trials standing on the left foot reaching in anterior direction. This procedure is repeated for the posteromedial and the posterolateral reach directions. The tape should be only touched lightly with the toes and the examiner marks the most distal point of contact on the tape. A trial is not considered complete if the participant touches the tape heavily, comes to rest at the midpoint, has to make contact with the ground to maintain balance, or shifts the foot of the stance limb. To score the Y balance test, first calculate the average reach distance in each direction in centimeters, by taking the average of the 3 trials for each direction. So you should have 6 values, 3 for the left leg and 3 for the right leg. Then calculate the distance in each direction as a percentage by taking the average distance in each direction, divided through the patient's leg length and multiplied by 100. This test can be useful and helpful to determine deficits and asymmetries in individuals, as well as assist in the return to play decision-making process. For example, a study by Butler et al. In the year 2013 concluded that college football players who had a composite score below 98.6% were 3.5 times more likely to get injured. Plisky et al. In the year 2006 has found an anterior reach asymmetry of greater than 4 cm predicted individuals at higher risk for lower limb injuries in basketball players. Be aware, however, that there is a huge variance in performance and injury risk between sports and sexes, which is why no clear cutoff values for asymmetry are described. Thanks a lot for watching. If you're curious about the Star Excursion Balance Test, click on the video right next to me. As always, feel free to give this video a like if it was helpful to you, or drop us a comment down below. You can find more info about us on our website or on our other social media channels. This was Kirsten for PhysioTutors. I'll see you in the next video. Bye!
Issue applied in Ecuador. We have that the patellofemoral pain syndrome is a common source of knee pain that has been estimated to comprise approximately 25 to 40% of knee ailments observed in orthopedic and sport medicine physical therapy settings. And in conclusion, we have that these findings suggest that patients with patellofemoral pain demonstrated abnormal lower extremity kinematics when compared to gender-matched control. Additionally, the LEDs may be an appropriate screening tool for the population with patellofemoral pain. Thank you so much for your attention.